everyone. In this quick video, I wanted to highlight how we would code COVID-19 since it's such a big topic right now. So I'm going to show you a couple different scenarios, one where a patient has COVID, one where they're just being tested for COVID. So let's go ahead and say our female's 30 years old, and we're going to pick the code finder. I'm going to hit continue. So I'm going to add a diagnosis, and I'm going to type COVID-19. So right here, disease or infection. So you can see all of these. Asymptomatic, if our patient's encountering an antibody test, if they've been exposed to it. So the first scenario, let's just say that our patient's just coming in for a screening, right? They just want to be tested. So I'm going to pick screening. From here, we can either pick if they had an exposure or no known exposure. So we're going to say no known exposure. And it asks if our patient had any kind of history of an infectious disease or contact with a communicable disease. So we're going to say no. So this is contact with and suspected exposure to other viral communicable diseases. So if you think the patient came in contact, that's what we would code. So I'm going to hit continue. I'm going to do on next patient. Same thing. We're going to pick one that's 30. Let's just say our patient's coming in for a test for COVID. Right there, we're going to pick that. So that would be Z01.84. So encounter for antibody response examination. So if the patient's coming in just for testing, that's the code we would assign. So I'm going to hit continue. Next patient. This patient, we're going to say actually does have COVID. So I'm going to type COVID for my diagnosis. We're going to say that they have signs or symptoms, and then we're going to pick what they are. So let's say our patient has chills, loss of smell, loss of taste, and muscle aches. I'm going to hit continue. Now it's asking me for the muscle aches. We're going to say we don't know, it's unspecified. So here we have all the diagnoses we would assign. We would assign U07.1 for our COVID-19 patient being sick with COVID-19. Then we're going to code what the manifestations of the COVID sickness are, which are the chills, the loss of the smell and taste, and the muscle aches or myalgia. I hope you found this helpful as we look at coding COVID.